So, good morning. My name is Muhammad John Jumsari, a second year medicine student of Southwestern University, FINMA. Could you please state your name and your birthday as well, please?
My name is Mohammed Hawi G. Sharif. My birth date is September 28, 2006.
Alright, so for this morning, what I'll be conducting unto you is the physical examination for the musculoskeletal. So that will include your temporomandibular, along your head and neck, and then your shoulder as well as its girdle, and then your elbow, of course, and then hand, wrist, your knee, and then your ankle and foot. So this also would include your hip, and then at your back, your spine. Would that be okay with you?
Yes.
Okay, so do you consent and agree on participating in this physical examination demonstration?
Yes.
Alright, so thank you very much. Now, without any further ado, do you have any questions?
No.
None at all. So, what I will be doing at first is to inspect your temporomandibular joint. So, your temporomandibular joint includes the three temporomandibular muscles. So, these are the masseter at both sides, and then your pterygoid. These are your mastication muscles, and then your temporal, the temporal. So, in inspecting and then in palpating, would you please open your mouth for the mastication range of motion? Okay, so please open your mouth. Okay, and then would you please move your jaws left, and then side, right side. Okay, okay, so you can close it. So does it feel painful?
No.
No, none at all. So without touching it, but by asking you to please open your mouth again. Okay, and then forward, move forward your chin, and then at side, and then at the other side. Okay, okay, okay. Okay, that's good. That's already good. So what I'm trying to elicit here is any crepitus or crickets that would signify that there is a swelling or any crepitus present onto your joints or your muscles. But in your case, there's none. So I will now move on downwards. Cephalocaudal is to your shoulder. Now for your shoulder, as I am inspecting it for its girdle also, I will be looking at for any deformities, abnormal formations or deformities, swelling, and then inflammations. However, by just looking, there's none. And then still relating to the shoulder, I will have to ask you to please resist my hand. So you move upward. Okay, so that's for the muscle strength. So a grade of 5, which you have, is already the most normal. So that's very normal. Now, extending it to the range of motion of your shoulder, could you please stand up for me? Okay, move forward, center. Now, could you please flex or move forward your one arm, and then at the back, so that would be extension, and then back, and then for the abduction, so away from the midline, and then adduction towards the midline. Now could you please turn your okay, that's already okay. Now could you please turn your back, turn, and then could you please reach for your scapula with the use of your hand, so that would be the internal rotation. And then could you please both of your hands reach for the back of your head, so that would be the external rotation. So did you feel any pain at all? None. Okay, so you can see it now. And then what I'm trying also to elicit is any crepitus or any cracking sound that will indicate an abnormality. So aside from that, still on the shoulder, lastly, would be the external rotation test. So for the external rotation test, I would be pointing it and moving it outside. Does this feel painful?
No.
No. And then for the empty can test, would be this one. So does this feel painful?
No.
None at all. So these two tests are the composite test actually. Now let's move on to your elbow. Now for your elbow, I will be palpating for the olecranon process. So your olecranon process is at the back of your antecubital face or your brachial area. And then what I'm trying to do is like a ballotment wherein I'm trying to reach the surroundings or edges of the olecranon process and then see for any inflammation, bulging or swelling. But in your case, there's none. So for the range of motion under elbow, it would be very simple. It would be just asking you to, so the supination and pronation. So at the center first, so could you please move it downward, so that will be pronation, and then back, and then supination in the back. Now that would be also applicable to your other hand. So in this point, what I'm also trying to elicit again and again is for any crepitus and then abnormal sound. So in this case, there's none. So it is somewhat normal. So after your elbow, I will now be proceeding to your hand and wrist. Now for your hand and wrist, I will be palpating for the joints. So for the ulnar and then the radial joints, the sides, and then I will also be palpating the ball socket, so or the snuff box. Does this feel painful?
No.
So there's none. And then what I'm also trying to identify here is any crepitus, swelling, and inflammation again and again. So for the range of motion, since it is normal, for the range of motion under the hand and wrist, it would include flexion. So could you please extend? Anyway, in all procedures that I'm doing on one side must be done on the other side. So to save time. Now for the range of motion under the hand or wrist, could you please flex your palm or your hand to me, so downward plane, downward, and then upward extension, that will be your extension, and then back at the center, and then for the inversion, again eversion, or the radial deviation, and then the ulnar deviation. Now for the grip strength, please grasp my middle finger and index finger, please. Okay, and then try to pull it as I pull it also in the opposite. Okay, so same strength, 5, the most perfect grade for the muscle strength. Now for the carpal tunnel syndrome, this would include 3, the thumb abduction. So for the thumb abduction, please. Okay, so please resist my thumb with your thumb also. As I press it downward, resist it upward. Okay. Okay, so that's very good. Did it feel painful?
No.
Oh, none at all. Now for another carpal tunnel syndrome, it would include the tinal test. Now for the tinal test, I will be tapping the midline, the median nerve to indicate any possible signs of carpal tunnel syndrome. So I will be just tapping it, and then please say if it is painful or it affects one of your fingers, specifically that feels numbing or pin like. Okay. Yeah. Is it painful?
No.
Okay, so no sensation at all. So that would be your tinal. Your tinal test, and that means the patient is normal. Now, for the last indication for the carpal tunnel syndrome is the fanning test. Now, for the fanning test, could you please imitate the movement I'm also doing, the maneuver I'm also doing. So this one, and then like that. Okay, in full capacity. So this would give me any occlusion in the ligament, ligament between the wrist and then the forearm. That will indicate the occlusion also of the median nerve in between. Is it painful?
No.
Okay, so after quite a second, release. So, did you feel any pain at all?
No.
So, none. So now we proceed now to the spine. Now for your spine, please, could you please stand up? Could you please stand up and then, okay, so that it can be seen. Now for the spine, could you please move your hands forward, and then it's just like an exercise. Reach for your feet, or at least the ground, so downward. So that would be the flexion. Okay, so I'm listening also for any crepitus, and then I will ask the patient, is there any pain you felt? Okay, so none at all, so that is highly normal. Now for the extension, of course, that would be the opposite. Now for the opposite, would you please lean backward? Would you please lean backward? Okay, lean backward. Okay, okay. So no sounds at all, and then did you feel any pain?
None.
So there's none. So after that, also included in the range of motion is the rotation and then the lateral bending. Now, so for the lateral bending, it's like an exercise. You just move, okay, and then to the other side, and then again, and then to the other side. Okay, so there's no sound, and then did you feel any pain?
None.
None at all. Now, for the rotation, you would just have to stabilize this, and then move your side, facing me. Okay, and then the other side. Okay, and then again to me, and then the other side. Not just the head, but also but your full back. Okay, again. Okay, and then to the other side. Okay, okay. So no sound, and then again, did you feel any pain at all?
None.
None. So very good. So it is normal. Now, for the knee, to move on to your knee, this would include 3 sign tests. So this is the bulge, the balloon, and then the ballotment. For the bulge sign, the suprapatellar, I will be manipulating the suprapatellar and the patellar, as well as, of course, the snuff box or the socket. So I will be grasping with my one hand, and then with my 4 fingers at this side, I will be feeling for the patellar, and then will be moving it so that it can be exposed in the thumb area, and then with the use of my other hand, index and then the middle finger, I will feel for any minor effusion. So is it painful?
No.
So none at all. So applied to the other, that would mean or indicate that the patient is negative of any effusion or swelling and inflammation. So another sign is that will be the bulge sign. Now the balloon sign is very simple. I will be just creating a balloon like. So with the use of both my hands, I will be pressing downward. It's like milking also, but on both sides. I will be pressing downward with my one hand, and then the other pressing upward against the patellar, and then we'll be looking for any bulging, ballooning that would indicate a very obvious major effusion. In this case, is this painful?
None.
Okay, so the patient is negative of it, and then apply to the other side. Now, finally, is for the ballotment. So for the ballotment, it would also be very simple. I would just be, it's like a balloting. I would just be pinching and then getting getting the patellar under the snuff box, and then looking for an effusion. Is this painful?
No.
Okay, so again, a mixture of major and large effusion in this case. So it is very obvious if the patient is positive of any effusions. So under this case, there's none. So what I'm doing is I am polluting it. I am polluting it. And then apply to the other side. Now for the ankle and foot, it would only require me to conduct a range of motion. Now for the range of motion of your ankle and foot, first of course is the plantar flexion. So same with your hand and wrist flexion. Would you please? I will be focusing on the first dermatome or the first side. So please flex it, and then dorsiflexion. Again, plantar flexion, dorsiflexion, and then back, and then inversion, and then eversion, or out, and then inversion, and then eversion. Alright, and then apply to the other side of your ankle and foot. So that would be all for the sitting position. So now we will proceed to the lying position, supine position, so that I can also have an access with your hip, and then also with other parts of your spine. So okay, would you please stand up now? Alright, so now I will ask you to please lie down in a supine position. So, and then please, okay, okay, so comfortably, so please feel comfort. And then what I will be assessing now is for your knee, and then for your hip joint. So for your hip joint, what I will be doing is the range of motion, as well as for the rest of the hip, and then for the rest of the knee as well. Rather, now for the hip joint range of motion, first is the flexion. So for the flexion, I will have to bend your knee against your chest, and then the other. Does this feel painful?
No.
Alright. Then I'm listening as well for any crepitus or any abnormal sounds, and then any tenderness that will be reported by my client. Now, after the flexion, I will have you to undergo extension. So for the extension, I will move your leg away from the midline, and then to the side of the table. So does this feel painful?
No.
At your hip, and then to the other side, ideally. And then again, I'm looking for any crepitus. Now for the abduction, I will simply move your leg away from the midline. So away from the midline. And then for the adduction, I will have to bend your knee and then move toward the midline. So does this feel painful?
No.
None at all. So very normal. And then apply to the other side. Now for the external and then the internal rotation, for the first is the external, I will have to bend your knee and then turn it across your midline. So does this feel painful?
No.
In some cases, it can also be hyperextension, external rotation, and then to the other side. Now for the internal rotation, it will involve, of course, also bending the knee. So I will have to bend your knee and then turn your leg away from the midline. Does this feel painful?
No.
No. And then same manner, in the same case also, I will have to extend it away from the midline. So does this feel painful?
No.
No. Very good. So now I will have to move on to the knee. So for the knee, we actually have different types of range of motion under the knee. So one of which is the McMurray. So for the McMurray, I will have to grasp your posterior knee joint with my one hand, and then the other grasping your heel. And then by grasping, I will be using a cup hand. Now over the knee, I will externally rotate. I will externally rotate again, externally rotate for your lower leg. Now does this feel painful onto
No.
your neck? None at all. Very good. So applied on the other side. Now for the abduction stress and then the adduction stress, on the other hand, this would include the same manner. So 30 degrees. In a 30 degrees, I will be raising it. And then with my one hand stabilizing it internally, I will have to abduct the other lower leg, the lower leg away from you. And then please tell me if this is painful. Is this
No.
painful?
No.
No. Specifically on the knee. So for the adduction, it is just opposite. Instead of internal, for the one hand, it would be away. And then instead of away, on the other hand, it should be moving to the midline. So again, is this painful?
No.
So none at all. So now, I will now conduct and then apply it on the other side. Now for the anterior drawer and then the posterior drawer, first of course is the anterior drawer. For the anterior drawer, I need you to bend your knee in a 90-degree angle manner. And then what I'm going to do is to apply pressure against your knee. It could be the patellar, and then I will have to grasp for your tibia and then the femur, and then please say if this is painful. Is this painful?
No.
Okay. So for the posterior, instead of at the front, it would be at the back. So at the back, I will be grasping. So again, in 90 degree. So I will be grasping it. And then moving forward the femur. Okay. Again, I will be pushing the tibia posteriorly. And then I will be observing backward movement in the femur after this. Okay. So does this feel painful?
No.
So none at all. So the final and then the last range of motion under the knee, not range of motion but palpation under the knee would be the Latchman test. Now for the Latchman test, instead of 90 or 30 degrees, I will have to make you in a position of 15 degrees. So for the 15 degrees, I will be, with my two hands again, I will be pressing for the tibia forward, and then I will have to also press the femur backward. Okay? And then in between is of course the knee. So is this painful?
No.
Okay. And then to the other side. So that would be all. And then do you have any questions, further clarifications under this examination regarding your findings?
No.
None at all. So thank you very much once again for participating in this examination, and then see you next time. Stay healthy and God bless.